More people are being captured to enjoy the Basic Health Care Provision Fund in Yobe State, as additional 10,000 vulnerable children under 5 and pregnant women are registered under the scheme in Geidam and Gulani local government areas, 2 worst areas hit by the insurgency in the state. Adam Yusuf reports.
The idea behind registering 10,000 people to access healthcare services with ease is the key into United Nations agenda of attaining universal healthcare coverage under the Sustainable Development Goals. Target beneficiaries of the scheme in Yobe State are vulnerable groups in the communities. 75-years-old Fatima Isa and 80-years-old Malam Audu are among the enrollees in the scheme in Geidam, one of the areas ravaged by Boko Haram insurgency. They are part of those identified to enjoy the free healthcare program, with Gulani local government being the other benefited local government area. Yobe State Contributory Healthcare Management Agency, in collaboration with UNICEF, has so far registered more than 50,000 beneficiaries under the federal government Basic Care Provision Fund, while 86,000 others of the contributory healthcare system enjoyed referral cases with services under the formal sector program of the agency.
The agency has some vulnerable programs vis-a-vis the state equity or tax Buni equity program, the Basic Care Provision Fund program, and the Basic Care Provision and the UNICEF program and the BMGF program. All these programs are programs for the vulnerable.
This is coming in the light of massive rehabilitation, upgrade, renovation, and construction of primary healthcare centers across the 178 political wards in the state. In Damaturu, Adam Yusuf, NTA News.
Right, following the disruption of health services in Yobe State, we've seen efforts from that report. We want to expand the discourse as we connect to our correspondent live from Yobe, Yunusa, who is standing by to give us, situation report on how the Yobe State government is changing the narrative with the provision of remedy situations. Yunusa, please go ahead.
Okay, thank you, Ruth, and welcome to Damaturu. We are live from the headquarters of Yobe State Contributory Healthcare Management Agency, popularly known as YOCHMA, an agency established by Yobe State government by Law Number 7 in 2019, with its mission to fast-track the attainment of universal health coverage, reduce out-of-pocket syndrome, and of course promote efficiency, equality, and effectiveness in the health service delivery. Recently, the agency, in collaboration with UNICEF, commences the enrollment of vulnerable persons, most especially in insurgency-affected communities, to begin to enjoy free healthcare services, as you have watched on that report. While to discuss these and many other issues, joining me is the Executive Secretary, Yobe State Contributory Healthcare Management Agency, Dr. Babagana Tijani. Doctor, thank you very much for joining us on this Nation One.
Thank you very much.
Okay, from the background report, one is made to understand that your agency and UNICEF are collaborating to enroll vulnerable persons in insurgency-affected communities. So tell us more about this partnership.
All right, thank you very much. Just the Yobe State Contributory Care Management Agency recently got support from UNICEF to enroll 10,000 beneficiaries in the zero-dose LGS of Gulani and Geidam. And this is to complement other vulnerable programs in the agency, vis-a-vis the state equity program for the vulnerable society, tax Buni equity program approved by His Excellency the Executive Governor of Yobe State. And of course the Basic Care Provision Fund program, which is a federal government social intervention program. So all these programs in the agency, including the performance grant the agency got from Billiard, I guess, to enroll additional 2,500 beneficiaries under the schemes vulnerable program. So the agency has since gone ahead and enrolled the 10,000 beneficiaries in 20 doses of LG, supported by UNICEF, Geidam and local government.
Okay, briefly, what are the criteria of selecting the beneficiaries? Briefly.
In all these communities, they will have a community structure under the leadership of the Bulamas and the Mice and the Angwas of the affected community, including the Blue GC and the OIC in charge of that particular facility, headed by the Director of Primary Healthcare of the affected area, and identify those vulnerable in the society, especially less than under 5 pregnant women and also the poorest of the poor in the community.
Okay, thank you very much. You heard it all from the Executive Secretary of the State Emergency Contributory Healthcare Management Agency, YOCHMA, Dr. Babagana Tijani. As the saying goes, a healthy society is a wealthy society, and every life matters. It's back to you, Ruth, with the continuation of News Nationwide.
Thank you very much, Yunusa. You just nailed it on the head. Thank you.